To the coronavirus pandemic in the U.S., New York now just hours away from lifting its mask mandate as a growing number of states now follow those new CDC guidelines. But what Dr. Fauci said today, if you want to keep that mask on. There's also news tonight on the Pfizer and Moderna vaccines, what they're now seeing against common variants in this country, and the key antibodies, particularly in older Americans after 6 months. Here's ABC's Kana Whitworth now.
Tonight, as COVID cases and deaths plunge to their lowest levels since the start of the pandemic, health officials want fully vaccinated Americans to know they're safe indoors and outdoors without a mask.
But even if you have a breakthrough infection, the chances of your transmitting it to someone else is extremely low. Very, very low.
But Dr. Anthony Fauci also saying the new CDC guidance doesn't mean Americans have to stop wearing masks.
That does not mean that people who feel they want to continue to wear a mask should not wear a mask. It's not a mandate to take your mask off.
Most states are now racing to drop remaining mask rules. But for the 40 million people in California, masks are still required until June 15th, leaving business owners like Jonathan Carrillo, owner of Maria's Deli, to enforce the state restrictions.
It's so confusing that we enforce the rules for our employees, but for the public, my job is not to police the public. It's kind of, I'm leaving it in their hands to make the decision for themselves.
Businesses enforcing the mask and social distancing rules say they've already taken a hit. Membership at the San Diego gym down 25%. The CEO says masks are one of the main reasons.
And of the members who have frozen their membership, the number one reason is the mask. We are definitely, anxiously awaiting for the mask policy to go away.
For now, many Americans relieved to see the mask rules lifted.
It feels really, really good to be able to step out, bring my children out to the park, and be able to enjoy that.
But in North Carolina, the Kroboth family isn't ready to ditch them just yet.
I'm not risking him getting this. So I feel like we're locked back in the house again.
All three sons vulnerable with autoimmune diseases. And right now, they're too young for a vaccine.
It really hurts because it kind of keeps us all exposed and it can put like my brothers and things in danger.
And tonight, new research showing the effectiveness of vaccines. One study showing that in a lab, the Pfizer vaccine appears to work against the California, New York, and UK variants. And the Moderna vaccine also appears to work, including in older people, against all those variants from South Africa and Brazil, with neutralizing antibodies lasting longer than 6 months.
That's the key figure there. And of course, the data only goes as long as we've had the vaccines actually being used by the American people. Encouraging news, Kana, on those couple of fronts when it comes to the variants and the key antibodies. On the flip side, we learned that there's also a growing body of evidence tonight showing some concern when it comes to Americans who have immunocompromised conditions or with people who take medications that suppress their immune systems. We heard from that family there, and we've got to stay on this too.
Yeah, absolutely, David. So researchers are finding that depending on your condition, they're not seeing that high level of antibodies that they would expect. But doctors say antibodies are not the only things that protect you from COVID-19. So they encourage anybody with these conditions to speak with their physician about the benefits they could still see from being vaccinated. David.
All right, Kana Whitworth in California. Thank you, Kana.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.